Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin.
Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, persistent feeling of hopelessness.
Hello viewers, welcome to this week's episode on Health Watch on Advent Cable Network Nigeria. My name is Angela Nweze. What many of us may not know is that your oral health, that is the health of your mouth, is a key indicator of your overall health, well-being and quality of life. As you can obviously see, the mouth is the doorway to the body. A report by the WHO, that's the World Health Organization, says that 3.5 billion people worldwide are affected by some form of oral related disease, and most common oral condition is related to the teeth. For example, dental caries, popularly called tooth decay, is estimated to affect 2.3 billion people globally. So with this large population being affected, I think it's important to learn how to care for our mouth, especially the teeth. So today we shall be discussing oral health. My guest is Dr. Ebikwo Ayegba. He's a principal dental surgeon at the University of Abuja Teaching Hospital. You're welcome to the program, sir.
Thank you.
It's good to have you.
Yes, I'm happy to be here.
You know, when I was speaking to you on the phone, you didn't sound like how you look because you look younger. So it's good to have you on the program, sir.
Thank you.
So today we're going to discuss oral health, and I was amazed at the number of issues we have going on. You know, 3.5 billion people globally. That's a lot of people.
Yes.
But before we even look at why that is a problem, let's just have an idea or know what exactly is the teeth for. Is it just for chewing? I want to believe it's not just for eating, chewing and devouring food.
Yes, thank you. The teeth, just like you said, is for chewing, basically.
Okay.
Yes, it is for chewing.
And biting.
Yes, biting, cutting.
Yeah, okay.
Yes. Then also, you know, it gives form and shape to your face.
Okay.
That is why you see older women, it's as if their cheeks are sunken. Yeah, people don't really like that because if your cheeks are sunken, you look very old. Very old,
yeah. Oh, yeah. I see. Okay.
Yes,
okay.
Yes.
Okay.
It gives form to the face as well. If you consider somebody who has lost several teeth, you know, the cheeks, they just go in, they are sunken. You look old, just like an old woman or old man looks like.
Oh,
exactly. So you need your teeth to give you form and shape as well.
Okay.
And also, you need your teeth to help you with pronunciation of some words. That is why some people, if they have, you know, missing teeth in one place or the other, they can't pronounce certain words.
Okay, like
well.
Yes.
Okay. Because the pressure you are bringing out is just lost through that.
You never realized that actually.
Yes.
Okay. Like if you want to pronounce it V. Oh, okay.
Yes.
Okay.
Yes.
Okay.
You know, most people like open teeth, so at times those that have open teeth, very wide ones.
Yes.
Yes.
The struggle with some
some
pronunciation.
words.
Oh.
Yes.
Oh wow.
Yes.
Okay, so looking at the teeth now, number one for chewing, biting.
Yes.
And then number two gives shape to the
face.
To the face. And then number three, that it helps also pronunciation of some words. So the teeth is actually
very important.
Very important.
Yes.
Oh, great. Okay, so 3.5 billion people have problem. Oh no, okay, no, 3.5 is oral because when they say oral, the mouth, that's the tongue, the teeth, everything that has
the gums and stuff.
The gums, yes. But 2.5, I think about 2.3 billion people. The problem is with the teeth.
Yes.
What are we doing that we're not doing right? That number of people. I don't want to imagine what it's like in Nigeria. I don't want to imagine what it's like, you know, here in Nigeria in terms of the statistics.
Yes, the number is increasing. Let me say so because it's now that people are going into research, you know, to take note of all these dental issues. You know, I'm sure if we have our own statistics compared today and maybe 10 years ago, you will see that there is a marked increase in the number of cases that are present. You know, some have been lost due to lack of research.
That's what, yeah.
Yes.
Yeah.
But as it is coming up, people are doing more research, you know, into the various villages and schools. So we now have, you know, it's as if there's an increased number. That's why I said if you compare what we have now with what was done maybe 5 years ago, the increase is marked.
So what have we been doing? Of course, the increase is so much.
Yes.
Of course. So are we eating more sugar? Because I know everybody, when you eat it, it's not good for your teeth.
Yes.
What are we doing that is causing this rise?
Yes. Well, like I said, you know, research wasn't being done before. So
yes,
the number wasn't there. It's been done now, so we have the numbers. So that's why I said if you compare the number now with when we supposedly have been doing research, maybe like 5 years ago, there's an increase. Why? Our diet is more Western than it used to be.
Our diet.
Yes.
And the teeth.
Yes.
I thought it's diet and hypertension, diet and diabetes. What has diet got to do with the teeth?
You know, it's what you take inside that defiles you. Let me put it that way.
Yes.
Yes. You know, those things that tend to be sweet in the mouth, you know, just as they affect, just like you said, it affects, you know, hypertension and all, diabetes and all. Likewise, it affects your mouth as well. So those things that are sweet don't only affect your heart, you know, they affect your mouth as well.
So it's just the sweet things, or if you eat too much of a fatty food, or if you, because I'm imagining now, of course, whatever is going to get into your body will pass through you. It has to chew it at some point get it.
Yes.
So if you're eating more of a fatty food, it affects the teeth, or if you eat.
Let me.
Okay.
Yes, you know, back in the days, just like our great grandfathers and stuff, you know, they take more of food directly from the farm.
Okay, yes,
they just cook food directly from the farm. Vegetables, you know, grains and all. But if I ask you now, you must have taken this bottle of soft drink today. You know, you must have taken some pastries as it were today. You know, you must have taken maybe sweets and stuff, maybe chocolate and all today, which wasn't there before.
Years ago.
It is increasingly coming into our diet now.
Okay.
Yeah, you are sending the child to school. Inside the flask, there is tea. Beverage, sorry. You have beverage. You know, there's biscuit to follow it. And when the child comes back, there's a bottle of soft drink waiting for him, maybe, you know, ice cream and stuff. So the things that we weren't taking before, we are taking now.
A lot of it now.
You know, and those sweet things, let me put it clearly, refined sugars, the ones that are refined, and those are the ones that are the main culprits, you know, in causing, you know, dental problems.
Okay.
Yes.
So as bad as this food is inside your body, is equally as bad as it is when you take them. Of course, this is the first place they go to.
Yes.
Before. Okay. So what do these things do today when you take them? Is it okay? I know there's this thing that was going on. This particular fizzy drink. If you put, pull that into. Is that what it does? Really? Is it like when you drink it? That's what.
No. That's not what it does.
Okay. So how does it? What? Okay.
Let me tell you how it happens. You know, the way God made us, you know, we have some bacteria in the mouth that God put it there. They are there with us.
Okay.
Yes, they are normal oral flora bacteria.
So they're there to maybe balance, clean the or what?
Yes.
Okay.
Yes.
Okay.
Yes. So they are normal, we are living with them.
Okay.
Yes. So they like these sweet things.
Oh.
Yes. Who doesn't like sweet things?
Even the bacteria like sweet things.
So usually what happens is when you take those things that are sweet, those bacteria feed on them.
Mm-hmm.
Their byproduct of what they do is acidic. So it's that acid that wears your tooth down.
Okay.
Yes. But God also did something for us to protect us from that. You know, we have saliva in the mouth. So,
Yeah. Mm-hmm.
you know, when the saliva has is a buffer, so as the pH goes down,
Mm-hmm.
the saliva buffers it. So that it's maintained, yes, at an equilibrium.
Okay.
So usually when you take something that is very sweet, the pH goes down.
Mm-hmm. It becomes more acidic.
Becomes more acidic.
Yeah.
You know, the saliva buffers it. But if you keep taking it regularly, you know, so that's what happens. You keep taking it regularly, the saliva buffers, you know, but it gets to a point where, especially when you are asleep, the saliva doesn't flow very well. Like when you are awake, you are talking and all. So that your teeth are baited in an acid environment. If you sleep from 10 till 6, so it's from 10 till 6 a.m., your teeth are baited in acid. So more of the damage is done usually
at night.
Yes.
But is it only peculiar to sweet things, or there are other foods that?
Yeah, it's peculiar to sweet. It's like I said, refined.
Oh, okay, yes, as in
yes, refined.
non-natural
yes,
sugars.
Yes,
okay, like your fizzy drinks, your
yes,
cakes, your sweets.
Yes.
When you take them. Oh, now I see why they say you should brush your teeth in the evening. Does it change anything?
Yeah, we advocate that you brush in the evening before you go to sleep.
Okay.
You floss, you brush. Then you won't take anything again till the following day.
Okay, you know, I'm going to come back for us to talk about this floss and floss and this thing. So now, if you take sweet things and then you drink water,
yes,
or you rinse your mouth, does it make any difference?
Yeah, it would.
Okay.
It would.
Okay.
Yes.
Okay.
Yes. Like I said, it's repeated assault on it. It's repeated assault. That's where the harm.
Okay, it happens.
Yes.
Okay, just for the benefit of the people that are watching now.
Yes.
So what happens is when you take things that are refined, that are too. You see, when you talk about this, the fizzy drinks, the sweet things, people just think is just for the inside, the body.
Yes.
But actually, it has.
Yeah, it has.
In fact, the problem starts in the mouth.
In the mouth, yes.
So when you take these things, your bacteria feed on it, produce the acid. And then these are the acids that cause the
decay on the tooth.
The decay on the tooth.
Yeah.
So that's the basic. That's the basic that causes it. So it's not possible to naturally just have constant problem with your tooth being wearing out, or this has to be the only process, or?
Yes, basically, yes. There are several theories that we won't go into that. It's mainly academic.
Mm-hmm.
Yes, but this is the one that mainly captures, the process.
Okay, but are there now foods that you can eat that helps the bacteria in your mouth behave normal?
Yeah, the normal oral flora, they help us by causing the ones that will cause harm not to grow.
So this is good bacteria now.
Yes.
Fighting for us against the bad ones from growing.
Yes.
So if you maintain a good balance in your mouth.
Yes.
Or in a normal day, where does it stay? Does it stay more neutral? pH level 7.0? Is that what on normal without taking, of course if you take something sweet, it becomes. So on a normal listen, you have a neutral kind
like
of
6.5.
Okay, 6.5.
Yes.
Around okay.
Yes.
Okay. All right, because I just wanted to, the bacteria thing is just playing around in my head.
Okay.
So that really, because I know in the gut there's the guts bacteria, and sometimes when they're damaged, it causes a lot of problems.
Yes.
I didn't realize we have this number of.
Yeah, in fact, we tell people not to use these mouthwashes too often.
Okay.
Yeah, they affect or destroy the normal oral flora too.
hold on. Okay, now, lately,
Yes.
I started noticing pain in my teeth. I think I'm your first patient today. And it started like four days ago. I noticed that there's this pain around the tooth area. It's difficult to chew with this area, you know. Now, because we're talking about this mouthwash, and I realized that I got a particular brand of mouthwash, and since I started using it, that's when I started feeling that. I don't know if it has anything to do with that, but I'm just telling you as a professional. And then I realized 2 days I haven't used it, and I'm fine. I haven't really felt anything. But we'll go on a break, and when we come back, so that we'll talk about my matter. And hoping that there are people watching who are having similar problems, so that they can learn from this. Let me be the guinea pig for today. All right, we'll be right back, viewers, with more of this discussion on oral health.
Now streaming, now analyzing, now assessing, now discussing, now sharing your thoughts on everything and every issue that affects you. ACNN is now streaming, discusses the issues trending and the matters that matter to us all. Join us every Monday to Friday at 10 a.m. on ACNN as we go in depth into every issue that impacts our lives, our communities, and our country.
Welcome back, viewers. Before we went to the break, we're discussing oral health, and my guest is still Dr. Ebikwo Ayegba. Thank you very much, sir.
Thank you.
Thank you. I've learned so much today. But now back to my matter.
Yeah.
Back to my matter. And I noticed that just because you said this and it clicked, that for 2 days I haven't used the mouthwash. The pain has been there, but for 2 days I didn't use the mouthwash. I think I'm feeling better. I don't know if I've presented my case properly.
There are so many things that can cause the pains. So, your teeth, or rather your tooth sits inside bone. A socket of bone. Then you have the gum, the one that you see when you open your mouth. Yes. Then you have other things that attach the tooth. We call them ligaments. The tooth to the bone. Yes.
So something is attaching the tooth to the bone.
Yes.
Which is covered with the gum.
Then there's the bone underneath that the tooth sits inside. Yes.
All right. So sometimes in the mouthwash.
No, what I'm trying to say is so many things can cause the pains. Yes. It could be from the gum. It could be from the tooth itself. Yes, from the ligaments or from the bone.
All of them still present the same kind of pain?
Yes.
All right. So it's when you do...
Yeah, when we examine it closely. When we take a radiograph. Yes, like an X-ray. It now tells us where the problem is from. Yes.
All right.
Yes.
Which means I need to come and see you so that I'm sure that I'm fine. But because I've never had any issues with my teeth, I try to do the right things.
Most people they boast in this way that I've never been to the hospital for the past so number of years. Or since I was born, I've never been to the hospital. They beat their chest as if it's something that they
proud of.
Yeah, it's not something to be proud of. Just like your car that you take for checks regularly, you're supposed to take your body for checks. Unfortunately, most people take the rest of their body for checks, but their mouth, they say, is it not these teeth? Is it not these teeth? These small teeth? So they don't. So even if you are not taking anything from this discussion, regular checks, just like you do your body, you do for your mouth as well. It goes a long way.
I must confess, I've never.
It goes a long way. Yes, we need to change the way we see the dentist. most people, it's pains that bring them to the dentist. But somehow, what causes the pain is lost somewhere to the point that they feel it's the dentist that causes the pain. And that's it. I'm telling you the truth.
Oh, really?
Yes, some people feel, the dental chair, don't go there. It's as if that's where the whole pain in the world comes from. But when you look at it critically, it is pain that brought that person. Yeah, I just saw one man recently say, if you take your teeth to the dentist, you keep it. But if your teeth takes you to the dentist, you may lose it.
You may lose. Okay, yeah. I'm just feeling guilty sitting here because I don't think I've ever been to the dentist.
Yeah, I know it's something that we should
imbibe, should be a culture.
Yes.
How frequently should we?
Every 6 months is okay.
Okay.
Yes.
Okay, I think I'm going to ask questions on some things that is around. But okay, when you say something, let me let you conclude on your thoughts.
Yes, like I said, I want to every 6 months. It doesn't have to be when you have pain that you go.
Okay. Even when there's nothing.
Yes, I just want to check my mouth.
Okay.
I want to check my mouth.
Okay, so when somebody comes to you, of course you check their teeth, but you also check the condition of the mouth environment to be sure everything is okay.
Yes.
I know that.
Yes.
Okay. Recently there are lots of these things on whitening of teeth. You have all these, even some toothpaste. You see, one is for the tooth brushing, the other one is for whitening. People say they go for whitening. Is it a good thing to go and do? Is it a good thing to meet you? Can somebody come to you and say, I want to whiten my teeth? Or why would somebody, before we go to why would somebody's teeth not remain white?
Yes. People do it. People, everybody wants to look fine. Yes. There are some persons that when they were little, either they took some drugs. If you go for antenatal, let me just start from this place.
Okay.
There was this alma mater conference some years ago where primary health care was discussed. So it has 8 elements. If I can remember all of them, there's maternal health, provision of good drugs, safe environment, safe drugs, Unfortunately, the oral health wasn't captured in it. So we are suffering that now. It was captured much later. But if you go to a primary health care center today, there's no oral health as part of it. You only do immunization, maternal health, what else? Every other thing.
Safe drugs.
Yes, safe drugs.
But you
so
don't.
Oral health is not there. So at that level where everybody is supposed to be able to access oral health, it is not there. So even if you are putting up a primary health care center tomorrow, oral health will not be captured in it.
Oh, wow. Because it's actually overlooked.
Yeah, it's overlooked.
It's not even considered.
Yes.
And the interesting thing is that this oral health that is not considered globally, the 3.5 billion people that have issues with it.
Yeah.
And I don't think there's any other ailment that affects that number of people.
Yes.
Wow.
Yes. It's huge. So going back to bleaching that we're talking about, whitening of teeth. Yes, whitening. Most people that come for antenatal, especially even at that primary health care center, they tell them some drugs that you shouldn't take when you are pregnant, like tetracycline. If you take them, the mother takes it, the children's teeth may come out brownish and all.
Okay.
Yes.
Okay.
So those ones you can bleach.
Okay,
but some of them can be so deep that you may need to do some other procedures, like crowning, in order to mask the color.
That's for the children after the parent. The mother takes tetracycline. Okay.
Yes.
Okay.
Yes.
Okay.
But there are some, like we found out, the color of your skin somehow goes with the color of your teeth, basically. Yes.
It's very dark.
Yeah, your teeth appear white.
White. Ah.
It gives a dark background.
It gives a dark background, yes. But is a white teeth, is it an indication of a healthy teeth? The fact that your teeth is white, does it mean your teeth is in a very good position?
White, not really.
Not really. Because just as you said, some people, it could be, it doesn't appear white enough because of their skin.
Yes, you know, some can be so consumed about the color that they want a white teeth no matter what they want it, you know. So in that case, they just want it white, that's all. Yes. Any whiter shade that is available, they want it.
They want the white.
Yes.
So it doesn't. So really, your teeth may not be white, but it's still healthy if you're doing a normal checkup.
Yes.
And
my teeth, they are not white, but they are healthy.
They're healthy. Of course, you should be healthy. Of course, you should be
practice
healthy.
what I preach.
You practice what you preach, which is good. Which is good, because I'm just thinking now, I think I need to see, okay, maybe I'll start with visiting you to check and be sure that everything is okay with me.
Yeah.
And let's talk of toothpaste.
Okay.
That we use in cleaning the mouth.
Yes, yes.
Does it clean the mouth?
Let me take it from here too.
Okay.
You know, back in the days, the olden days, you know, they used chewing stick. Yes.
Yeah.
But you could see somebody carrying chewing stick, just put it in the mouth, goes to the farm, goes around with it every time or everywhere all through the day. But it doesn't use it to brush it. It just puts it there.
Okay.
So it's just there. It's
they're not doing anything.
Not doing anything.
Okay.
So that that chewing stick is supposed to be used effectively.
Okay.
To brush.
Okay.
Yes. Coming to toothpaste that we use now, there are several.
So many of them.
Yes, there are so many.
Promising so many things.
Yes, there are so many of them. But I will recommend the ones that are made, or rather, that has this Nigerian Dental Association that it recommends.
Ah.
Yes. So anytime you are buying a toothpaste, you look on the body. Does it have endorsed by Nigerian Dental Association?
Okay.
Yes. Yes.
So which means the dental association would have looked at it and seen that it's proper to be used for the Nigerian person.
Yes.
So that's what everybody should know. So when you buy your paste, no matter how beautiful it looks,
no matter how
foreign it looks, or how advertised it was. Look at it and know that it's approved by or recommended by the Dental Association.
Yes. There's something that's inside the toothpaste. We call it fluoride.
Yeah, that's the popular one.
Fluoride in the toothpaste. You know, it helps to strengthen your teeth against decay.
Okay, the fluoride protects against decay.
Yes.
Okay.
Yes.
Okay.
You know, before we used to have pipe bomb water that goes everywhere. You know, so at those places they add some of this fluoride into the drinking water that goes to the community.
All right. Okay.
But if I ask you, you have your borehole in your house.
Yeah.
So, based on that, you know, the quantity of fluoride in the toothpaste is regulated. Having it in mind that we don't have it in public water. Nobody gets public water as it used to be before.
So fluoride is important in the toothpaste.
So, but those foreign ones, you know, they can have fluoride even in their salt. They have it in their sugar. They have it in most of their food. So the fluoride content in most of those foreign ones are not as much as
the ones that are made look. Okay.
Yes.
Oh, now I understand. So in the foreign ones, that especially the ones not recommended by the Dental Association of Nigeria, there is the content of the fluoride is not enough as commensurate to what we live, our reality in this part of the world. All right. Okay. So it's important. Look out for that approval from the Dental Association. Endorsement by the. It's because of the fluoride, and the fluoride helps in protecting the tooth against decay. Decay. Very important. Very important. Okay. When we come back, we're going to another break, but we'll come back. We'll talk about how to brush the teeth well. So that we know we're doing the right thing. And then we'll talk about some things that I know we do, like using of charcoal to wash our teeth to know if it's the right thing. So we'll be right back, viewers. Hi, my name is Oluwadamilola Ilupeju, and I'm your host on the program Joshua Generation.
This program promises to be so enriching, wonderful, fun, and interesting.
Use the say are the leaders of tomorrow. What do you think will happen to the next generation if these youths are not trained for tomorrow?
We are a chosen generation. We've been called for to show His excellence.
A particular set of people that has a demarcation. Never ever think you are a mistake.
We are a chosen generation.
The light shines in the darkness, and the darkness cannot comprehend it. That is a legacy.
Has given me, for I know who.
Joshua and his generation saw the miracle. They walked through the Red Sea.
Whenever you introspect, there are deep desires of the heart that you wish you could do.
Where He says I'm at, I know who I am.
There are lots of distractions for young people around the world right now. If you don't engage them in the church, if you don't support their talent, nature abhors vacuum.
I am believing God that the Lord will move again, once again, in our time and in our generation, and our eyes shall see it.
Welcome back, viewers. Before we went on the break, we were discussing your oral health, and my guest is still Dr. Ebikwo Ayegba. Thank you very much, sir. I think I'm learning a lot because I'm a victim, so I'm learning so much of taking care of the teeth. So we talked about fluoride. Let me just go recap it again. When you want to buy your toothpaste, look out for the one endorsed by the Dental Association of Nigeria.
Yes.
Because
exactly.
it has enough fluoride.
Yes.
To help in protecting the teeth from decay. Those ones that are foreign, that they might not have enough,
yes,
to meet to what is required in our
locally.
own climate.
Yeah.
Okay, so thank you very much. That's a very good one. So I'll go and check my toothpaste now when I get home, if it has the dent. If not, it's going to the bin. Okay, so now let's talk about how to brush. Now it looks like in primary school, say brush up, down, left, but really, not many people know how to brush.
Yes.
It's amazing.
Yes.
Yeah.
Let's start from the toothbrush itself.
Okay. Okay. So there's a problem with the toothbrush.
Yes.
Yeah. Okay.
Yeah, I see some patients that they really want to keep their mouth clean.
Mm-hmm.
So they go to get a very hard one because they feel the harder, the better.
Oh my God, there is one particular brand. Oh.
Yes.
It's so hard.
Because of the way they have used it, because the toothbrush is very hard, they have worn grooves on their teeth.
Okay.
Grooves like gutter.
Oh wow.
Yes.
Oh, these teeth like this.
It wears down. So after some time, the thing will just break. Yes. So wrong use of very hard toothbrush.
We shouldn't use hard toothbrush at all.
Yes, cause a lot of harm. So we recommend that, just like I said, you come and clean your mouth in the clinic. So when you do that and you get a soft brush, it is very okay for you, and you use it very technically, use it well. You are okay, very okay.
Okay, so you need a soft toothbrush.
And you go for cleaning regularly, like
How
every year.
Do you clean? Every year, once a year.
Yes.
I don't want to say what I want to say right now.
I don't even want to hear.
I don't want to say what I want to say right now, but let's just continue. Okay, so the toothbrush shouldn't be hard.
It shouldn't be hard.
It shouldn't be hard. Then you have the ones there's the one that is just flat on the top.
Yes.
And then there are some that have different, some are longer,
yes,
some are
yes,
smaller, some are round in the middle.
Yeah.
Does it make any difference?
Yes, it does. I think what happens mainly is how you use it.
Okay.
Be it flat or has
all those.
Yes.
So all those things don't really matter. It's how you use it.
It's how you use it.
Oh, okay.
It's how you use it.
Okay.
Yes. So your toothbrush should be soft.
Okay.
Then you should use it for 3 months. Then you discard it.
3 months?
Yes, you discard it.
Okay.
Yes. I think some people should get awards for using their toothbrush for years.
Okay. Okay. Now I see why my teeth are paining me.
Every 3 months you change it.
Okay.
Yes.
Okay.
And it's also recommended that if you get, even if you buy one today, and sometimes you take ill, like catarrh, upper airway respiratory infection, you just, as it's going, you discard it and get another one.
Okay.
Yes.
Okay.
Yes.
So your toothbrush. Okay.
Yeah,
okay.
you change it every 3 months.
Change it every 3 months.
Change it after you take ill.
Okay.
Yes.
Change it when you take ill after
Yes.
you recover.
Yes.
Throw
change
that
it.
one and use a new one.
Get
Okay.
a new one.
Okay.
It must be soft.
Okay.
Then the times that you brush are very important too.
Okay.
Yes.
Okay.
Last thing at night. This one goes for mothers too. You know, some children would like to wake up in the night and take something again. So it's best that, you know, when they are going to sleep, brush their teeth.
Okay.
Like I said earlier on, you know, when your teeth are in close contact with an acidic environment for a long period, that's when most of the harm is done.
Yeah, happens, yeah.
So we may feel that when you wake up in the morning, the one you brush in the morning is most important. No.
Okay.
That one you do at night.
At night is
Yes. So when you brush at night, when you are waking up in the morning, you can afford to take your breakfast first before you brush in the morning.
Okay.
Let me go over it again.
Okay, please do. Because, you know, there are people watching now,
Yes.
and I think you can send in your comments now with the numbers showing on your screen. Just send us a comment, send us your question. If you have any, just send to us, and then we'll communicate to the doctors. But go ahead, sir.
Yes. You know, we always feel that when we are taking our baths in the morning, your toothbrush is inside the bathroom, you brush, take your bath, then you go out. You know, we feel that, you know, you need to brush in the night, last thing before you go to sleep.
Yeah.
There's nothing inside your mouth, any refined sugars, any leftover food that's in your mouth would have been taken off. So your mouth is basically clean.
Okay.
Yes, so when you wake up in the morning, you can afford to have your breakfast first before you brush.
Okay.
Yes.
Okay, so what we've been doing, see what we know.
Yes.
You know what we know.
Yeah, yes. We all went through that.
We all went through that. So whatever you have been doing is wrong.
Yeah.
The right thing to do is brush last thing in the night. Don't eat anything again.
Yes.
You know, after you brush your teeth.
Yes.
Then in the morning you can afford to have your breakfast.
Yes.
Before you brush again.
Yes.
Then you leave.
Yes.
Not the normal thing we do. Eat, go to bed, brush first thing in the morning, and then eat the food. And now I see why we are artists in trouble. Okay, at least I can praise myself for the night one. You know, but it feels better in the morning when you brush at night. It feels a lot better.
Yeah, it does.
You know, when you wake up in the morning, you don't have all those feelings. Yeah. Okay.
Yeah.
All right. Okay, that's a good care for the teeth.
Yeah.
Okay, so the toothbrush, change every 3 months. Every 3 months. You know. Okay, before I even go over that, is there a way of cleaning the toothbrush? Maybe once a week, 2 times a week, or it's just okay to keep it? Because I saw somebody say something, soak the toothbrush overnight in a mouthwash, and it will be clean.
Yes, we just recommend when you finish brushing, just rinse it very well.
Okay.
Then keep it in a secure place.
Okay, and don't allow those little things inside. You know, sometimes the toothpaste can remain.
Yeah, you know, you rinse make sure everything is off. Rinse it very well.
Okay.
Yes.
Okay. Okay, that's a bit. Let's talk about tumor.
Let me just take us back a little.
Okay, no problem.
Yes. You know, children can have decay as well. You know, we are wont to just tell the child to go and brush.
Yeah.
They may not do it well.
Do it well. Yeah.
So I think mothers and fathers too, you know, you can brush your child's teeth even up to the age of 10. You know, you can alternate. Say, okay, in the night you just brush for him. In the morning he does it for himself. If it's too much for you. But I tell you, if you do it for them, you will be happier for you, because seeing a child with toothache can be very harrowing.
The toothache children have, is it the same one with their milk teeth? When they're younger.
Can have the milk teeth can be decayed, and they can have pains from it, as well as the permanent ones.
Oh, okay.
Yes.
Okay.
Yes. So you can see a child that's 3 years old, with tooth decay already with pains. Yes. Yeah.
That's horrible. So the brushing at night is not just for adults.
No.
For children as well.
Yes.
Brush at night.
Yes.
And then you especially help them.
Yes.
Brush properly.
Yes. Children love to take ice cream and sweet stuff. So we recommend that they take them during meal times.
Okay.
Yes.
After a meal or
yes.
Before? Okay.
Especially before a meal.
All right. They shouldn't just eat it.
Yes.
Before nothing.
Yes.
Okay.
Let them take it before meals. Why? Because when they are taking the meals, whatever refined sugars are there, whatever you are eating takes everything and you take it in.
All right. Okay.
Yes.
So you're
So what we are trying to avoid is having the refined sugars in your mouth for an extended period.
Of time. Okay.
Yes. Yes.
Okay, that makes a lot of sense.
Yes.
I believe people are big that. When you're just saying everything you're saying, just to show you how we got to this actually.
Yes.
This number of people having tooth problems.
Yeah.
So the tumor, the tumor in does it just, is it because we don't brush as well that
No, that is a different presentation entirely.
All right.
Yes.
Okay.
It's entirely. Just like you can have decay in the mouth, you can have tumors on other parts of your body.
Yeah.
Your mouth has the tissues that are in every other part of the body, so they can also come down with any of those things. So whenever you notice anything that is untoward in your mouth, please come for checkup, because we see some children with tumors. Usually they are not painful, so they could just be going around with it. So by the time it defaces them, when they are coming, it's already grown so big.
Okay, so the ones that sometimes you see like looking like moms, looking like there's a pain here, or how is it? I don't know. How do you identify that?
I wish I had some pictures.
Okay.
We had a child come recently. So just the lower lip that was, very big. Since birth, and the boy should be about 7, 8 now. So you wonder where they've been since.
Where they've been since? I didn't know.
Yes.
So if you notice any little unusual growth.
Yes, we had also a 12-year-old girl recently too. With the swelling, it wasn't painful. So it nearly resulted in her jaw being cut off, So those are it. If you come early, the treatment is always easier and better for the patient.
For children, just as we said, you recommend that we do a dental check.
Yes.
Do you do for children as well?
Yes. Okay. Yes. Okay, let me go into that too.
Okay.
For children, especially when they are growing up, they are supposed to shed some teeth at some particular age. If you don't follow them up, maybe one is retained in the mouth for long. By the time they are getting older, you need to pay an orthodontist. Those ones that help you set your teeth with braces, pay them. Yeah. There's a huge sum.
Okay.
It's a huge sum.
Yeah.
So regular checks, prevent you from paying something
bigger
at a later date. Yes. So we recommend that when you come regularly and they see you, okay, this one needs to go and it's still there, they could help remove it. And if your child has a habit, whether it's sucking the thumb or thrusting the tongue or some other habits that can affect the mouth at a later date, there are some things they can do as well to help out. Yes. Yes. So what we're trying to do is there are some little things you can do now that will prevent something much later on.
Later.
Yeah.
Everything you have said today is actually things we do and take for granted.
Yes. When you have ulcers in the mouth, like a wound in your mouth, maybe it's there for over a week, please bring it for it to be checked.
Okay, now the ulcer part, let me understand. Just like sometimes wounds just appear on your mouth.
Yes.
The gum, and it's very painful.
Yes.
Is it the same?
Yes,
Okay.
all those ones, aptos also. Those ones, when you have stress and some other imbalances, like they come. But within a few days, they're supposed to go.
back, yeah.
But if they are there for a week plus and they are still there, you need to have it checked.
Okay.
Yes.
Okay.
Yeah.
Okay, I know. So even in between here, they see some.
Yes.
Some of them really painful. The pain
Yes.
is really, really bad.
Yes.
But
I must add too.
okay, right.
Smoking and alcohol, they are not good.
For the teeth.
Yes, for the mouth.
For the
especially.
mouth. In general.
Yes.
And they are the
Smoking,
first
alcohol,
contact.
Yes. Because they increase the risk of one having cancers in the mouth.
In the wow. So when people smoke, is it just the cancer, or I know it also affect the color of the teeth? Is it, or?
Yes.
I know sometimes they say people that smoke, they have
Their
this
lips
dark
are
lip
dark
and
yeah.
all of that.
Yeah.
Okay, it's because of the content of
yes,
the
the
okay.
content, yes.
Okay.
Yes. But we are mainly concerned with the cancers it can cause.
Okay.
Yes.
So even the alcohol itself.
Yes, it increases the risk.
Increases the risk. Oh, wow. There's a lot out here.
Yes,
there's a lot we have to do on our teeth to get it.
Yeah.
So when you now cold drinks.
Yes.
Does it? Even there are times you take drinks and then you have these sharp.
Yes, sharp.
And some adverts have told us that if you use a particular product, you won't feel it again. I don't know how true that is, but
yes, you won't.
Okay, all right. Some of the toothpaste. Okay.
Yes.
All right. Okay.
Yeah, they really help.
Okay.
Yes. And let me just say this. Whatever is causing something that is not normal, should be addressed.
Okay.
Yes. The toothpaste could just give you a relief.
All right.
It will give you relief from that. But whatever is causing it should be addressed.
Okay.
Yes. Because if you have a cavity, when you are taking something that is cold, it can shock seriously. So but when you use the toothpaste, it may ameliorate, it may abate, but it is not filling that cavity. Always clear.
Okay.
Yes.
Is there anything like worms in the teeth? This thing happened some years ago. My cousin she always had this pain in her teeth, and she went somewhere, I don't know, and they put something in the water, and she opened her mouth over it, and some things came out, and you laughed, I'm sure. It sounds like
you know that doesn't happen in a dental clinic.
Obviously, it's not in the dental clinic.
Yes, so it happens.
I
feel it's magic. Yes.
Okay.
Yeah, it's not scientific.
Right.
Yes. I don't know anybody that's alive can have worms inside the body.
Okay.
Yes.
Okay. So they do those things to make you believe that
it's magic. Yes.
Okay.
Well, in my years of practice, I've not seen a worm in somebody's mouth. Maybe after you extract the tooth, you now bring out the worm. It's something like that. Yes, it's. My teachers have not seen too, and the books that we read, none
has said anything like that. Yes. Okay, that's a good one. So maybe I should tell her that they fooled you.
Yes, those that go there eventually they end up in the dental clinic.
Yes, of
so
course.
why would you just come to the clinic, in the first instance instead of going to look for remedy, which is not enough somewhere else.
Does charcoal? Now, I'm asking for the charcoal. There's even a new toothpaste that is actually, it has charcoal in it, and it's really expensive. Not too expensive, but it's expensive.
Yes.
I remember when I was little, my mom would bring charcoal and, tell us to brush our teeth. Does it do anything? Is it a good thing? There are no studies yet.
What exactly those things have is abrasives.
Something tough?
Yeah, something tough.
Hard.
Yeah,
yes.
That's what it does. That's what it does.
Okay.
Yes. Let's say even the toothpaste that we use, you know, they use abrasives inside.
Some of them, yes, they have these particles in it to make you feel like it's scrubbing more on the surface.
Yes, so that's basically it's that mechanical thing.
Okay,
that's all it does. It's not as
so
if
that's all. It doesn't do anything.
That's all. Yes, it's not as if there's anything there.
Okay.
You know, let's say somebody has stains from maybe tetracycline use when they were little. You could just try it out with that charcoal and tell me what happens.
Charcoal
no, I'm just telling you nothing.
Okay, all right. Okay, nothing will happen. It doesn't make any difference.
Yeah, it won't make any difference.
Okay, so all those things are just okay, let's talk finally about the tongue, the mouth odor. The major issue, sometimes some people, you can't even go close to them.
Yes. You know, let's say you are in class, you brush your teeth from home, you get to class, you listen to a lecture for about 40 minutes. By the time so that is not any issue at all. You know, but there are some persons that you can't sit close to them. You know, it's really offensive. Yes. If you have a cavity in your teeth, your food that you ate are lodged in there. When it decays, the odor will be offensive. So there are many things that cause mouth odor. If you are not brushing well, there are some persons, when you look at inside the mouth, they have lots of calculus or tartar.
Okay, like those white things in between?
Yes, in between, yes.
Okay. It means you're not brushing well.
You're not brushing well. So your teeth, certainly.
Okay.
Yes, you have that foul odor from it.
Wow.
Yes.
Okay, so if you can clean, is that where the flossing comes into play?
Yeah,
you know, when they say floss? Because recently, you know, it's important. I've always been taught to floss, but people don't see the importance of
you need to floss.
Flossing.
Yes.
So that's the thing you put in between, just to take out everything in between the teeth.
Yes.
Okay.
So if somebody has mouth odor and you come, the doctor will check where it is coming from. Is it from the mouth? If you have infections in the sinuses, you can have it as well.
Oh, right.
Yes. If you have issues with your tonsils, you can have it as well. So they need to ascertain where it is coming from, and they will address it.
Okay.
Yes,
Okay.
yes.
So that's the thing for the smell of the mouth. It could be from. So when they come to the hospital to see you, and then you do the washing. Sometimes just the washing can even take care of it.
Yes.
Then the tongue. I think we'll be wrapping up there. The tongue. What do we do with the tongue? Because they said sometimes that's also responsible for smell.
Yes. Usually we have this tongue scraper.
Okay, the tongue scraper. Yes. You see it.
Then even with your normal soft brush, you could just brush. Yes.
So it's an integral part of your brushing time.
Yes, it's an integral part of your brushing time.
Don't leave it when you're brushing.
Yes.
Okay.
Yes.
I think
the tongue needs to be taken care of as well. While we are here, you know, those that have certain habits, you know, certain habits like or certain social way of things. Let me put it that way. You know, we had someone who was involved in like oral sex.
Okay.
You know, then develop certain things on the tongue.
Okay. Oh.
You know,
right.
so just like you have papilloma virus. Yes, it affects the tongue as well.
Okay.
So there are some things that you need to keep away from.
Oh,
in order
right.
that.
Okay. One of the care of the mouth is also oral sex shouldn't be a consideration.
Yes.
That's the word.
Yes.
Okay.
Well, that it's, let me not say.
Exactly.
Yes,
I understand.
But in a setting where as Christians, where a marriage setting, I don't know how some people see it though. But
okay, but of course it's because just like human papilloma virus, when you have lots of partners, then you become more predisposed to them. Okay.
Yeah.
Thank you so much.
I think there's a lot we need to talk about.
Yes, there's a whole lot we need to talk about. I think you need to come back then. So I'm going to pull you back.
Sorry, before we go.
Okay.
Whenever you are brushing your teeth, your mouth should be open. Your mouth should be open. Your teeth should not be touching. Yes, that way.
Oh, your teeth?
Yes.
Oh, right. So it shouldn't be like this.
Yes. I'm sure you see on certain commercials
Yes,
Where-
exactly. So why are we
it's
why
not-
are we
it's not
opening? Why
appropriate.
are
It's
we?
not appropriate.
It's not appropriate. Okay.
Yes, your mouth should be open.
It should be open.
Yes.
Okay.
Then the up teeth, you brush it down. Then the down teeth, you brush it up.
What if you're brushing your mouth open? You hold, but you.
No. Try it.
Okay, just try it.
Yes,
right.
try it. Yes, that's how I do it.
Okay. Well, the professional says so everybody should.
Yes.
Okay, so brush with your mouth open.
Yes.
You know, don't close it, and then that's the appropriate thing to do.
Yes.
Even if you try, don't worry, don't pour on. If you pour on, then you're brushing, so
yeah.
just clean it up. Yeah.
Yeah.
Wow. You need to come back.
Yeah, I know. There's a lot.
There's a lot to talk about.
Yes,
Even all the other how to even identify when you're having problems in your teeth, when to see to run to the dentist immediately.
Yes.
So I need to pull you back again,
Yeah,
so that we'll have more discussion on this.
It's okay.
You promised me. You promised us in the studio. You promised the viewers.
Yes.
So they'll be looking to see your face again.
Okay.
All right. Thank you so much for coming on. I
It's
think
a
I've learned
pleasure.
so much, and as I've been saying, now I know why my teeth are paining me. Thank you so much, and thank you so much, viewers, for staying with us. I believe, just as I have learned a lot, I believe you have learned a lot on why your teeth is the way it is. You need to see the dentist, okay? My guest has been Dr. Ebikwo Ayegba. He's a principal dental surgeon at the University of Abuja Teaching Hospital, and he has really opened our eyes today. So thank you so much for joining me on the program. I'll see you next time. My name is Angela Wenze. Goodbye.